I used something called an ice wave patch. I have a bad left knee and it hurts all the time. And I looked at the video on how to use it and I'm like, give me a break. I should have put it here and then put another patch and move it around until you're not in pain. Well, I said, okay, I'll try it. I did that. I got it to the right point, and in about 15 seconds, my knee pain was gone.
Wow.
I said, now that's not a placebo effect because I was expecting it not to work, not the opposite. So I dove into this. The phototherapy, this is a manner of doing that without putting stuff into your body.
Dr. Armine, thank you so much for joining us.
Howdy.
So tell us about yourself and how you got started in functional medicine.
Well, I've been in healthcare practitioner for going on 46 years now. I actually started as an EMT in New York City and became a paramedic. And then I went to nursing school and became a registered nurse. And I enjoyed that because most of my nursing experience is in critical care and emergency. Beyond that, I was in the Army for a while and as a Army nurse. And then I drifted towards chiropractic and found out that the whole alternative medicine angle was something that really resonated with me. And what really resonated over time was putting figuring out the puzzle of what was wrong with someone. Musculoskeletally was rather easy. But then I started doing some nutrition, some what people might call woo-woo stuff. But I found that there were a load of people out there who had no idea what was wrong with them. They were treating according to standard medical or allopathic protocols, and they weren't getting anywhere. And they were, frankly, tired of being ill all the time or just managing their illness. During this whole thing, one of my children became very ill with a serious mental illness. So I kind of looked up at God and said, this disease is messing with the wrong daddy, and with a lot of help and a lot of study and an awful lot of help with practitioners and people like yourself, I started a knowledge base that allows me to treat those people who are way outside the bell curve, who have been here, there, everywhere, and simply can't figure out what's wrong. And more than that, even if they knew what's wrong, all the types of treatment that they've had have been ineffective for them. And this is an ongoing thing. And, I'm known very well. I'm known around the world as Dr. Jess, and don't ask me how that started. No idea, but it stuck. I'm going to tell you. I'm not going to argue with everybody. I'm like, okay, call me Dr. Jess, just don't call me late for dinner. I mean, come on, I started getting more and more tools in my toolbox and learning more and more about every different aspect of what heals somebody: sound, light, vibration. And I always say, all right, these are my tools. Okay, so when somebody needs it, I know what tool to pull out. And hence, I'm still learning about everything. I'm known pretty well for being in the epigenetic world and THFR and that whole nutrigenomic thing, in neuroendocrinology, restoring mitochondrial function, and so forth. Most people say, what do you specialize in? I said, what I am is a specialized generalist.
Yes.
Okay?
Yeah. And you are so knowledgeable. I mean, I trained with you years ago in genetics and your colleague, Sean Bean.
Sean, right.
And so I was really surprised to learn that you were also incorporating some bioenergetic modalities, some energy medicine into your practice as well. I was thrilled to hear that. So I wanted to have you come on and talk about that because I know you're so knowledgeable about so many areas of health. And so you sent me some of these Lifewave patches. This is kind of what they look like. So they're Lifewave patches. This is the X39 that you sent me. I was having a little issues with sleep and things like that. And you're like, oh, try the X39 right away. And so let's just talk about first, like, what are Lifewave patches and like what is the kind of the premise behind them and how they work?
Well, the Lifewave patches are essentially a skin patch, but let me qualify, they're not transdermal. We know that there are patches that put medicines or vitamins through the skin. This does not do that, okay? These patches, which they all look like this, and they may have a brown or white in the middle, are a collection of amino acids or certain peptides and crystals. I was like, okay. And what they do is you put them over certain points in the body, and they use your body's infrared energy to activate them. I got introduced to this really a few years ago, and I was asking people, so what does it do? Okay. And they kept talking about the copper peptide and this, and I said, thank you. Now tell me how this creates that. And I would always get that blank stare. Okay, it's like, no. You've got to tell me how this, I know what a copper peptide does. I can look that up, but how does this do that? And I finally found out that that photobiomedicine or photobiostimulation, if you will, okay, that you can use light to activate what's in here. So think about it. The light hits this and then reflects back into you. Whatever it's doing is reflecting back into you. And then here's the critical thing. And don't tell anybody. It's over acupuncture points. So when they have a patch to help addictions and stuff, and it's called SP6. Okay, the name comes from spleen 6, the acupuncture point.
Yes.
Okay, and they give you different points that you put it on. So I was sitting there thinking about it, and I said, and anybody who already knows me realizes I don't hawk anything. I don't sell. Even if you look at the butter I use for restoring leaky guts, it's a combination of products. I don't sit there and sell a kit or anything like that, because I'm kind of sensitive to that because, as much as I respect people who do that and do research and put the good intention together, like yourself, with all the stuff that you put together, there are a lot more people out there who are, let me make a product and then backfill in the research, and I just want to move this product, and then all of a sudden you don't see them anymore. Okay, that bugs me because at heart, my job is to heal people. So when I looked at this thing, I said, there's no risk here, so let me try it out. So I got these patches, and I started using it with some of my patients, and I was impressed with some of the results. I used something called an ice wave patch. I have a bad left knee, and it hurts all the time. And I looked at the video on how to use it, and I'm like, give me a break. I should have put it here and then put another patch and move it around until you're not in pain. Well, I said, okay, I'll try it. I did that. I got it to the right point, and in about 15 seconds, my knee pain was gone.
Wow.
I said, now, that's not a placebo effect because I was expecting it not to work, not the opposite. So I dove into this. The phototherapy, this is a manner of doing that without putting stuff into your body that may have side effects or hurt it. A lot of my patients can't even put anything down their throats without it bothering them. This has been a lifesaver.
Yeah, and I feel the same way. Bioenergetic interventions are very, very simple, very inexpensive. They have no downsides there's no contraindications for them. Mm-hmm. And they're very simple to implement. And so they're just fantastic. And, they're easy to comply with also. It's easy for people to do. So this patch, this is the X39. So why don't we talk a little bit about this patch specifically and what it does? I'm going to put on one on right now.
Okay, wonderful.
My patch on.
Okay, the X39 is their most modern iteration of their patches. They have several different kinds. What this one's claim to fame is, and I can vouch for it because I've seen the studies, is that utilizing the X39 will stimulate the activity of your stem cells. And we've all heard the word stem cells, one way or another, but stem cells are your basic cells that turn into your other cells. So red blood cells a stem cell, believe it or not, is what's called an undifferentiated cell. It is a cell that's just kind of sitting there saying, what would you like me to do? Okay. And it can become a nose cell, or it can become a heart cell, or it can become a neural cell, or it can be a red blood cell, depending on whatever. But as we age, as we get older, as we get more assaulted by this toxic environment, the peptides that initiate the action of the stem cells starts becoming less functional. And this is the very basis of illness. You know, if you read the literature or the stuff that Lifewave puts out, it starts talking about bringing down inflammation, doing this and doing that, because we are wound healing, you know, straighten out the, you know, your wrinkles and so forth. And there's nothing, and actually it's correct, but we tend to want to think of things as, what can this do? You know, what can you do for this? What can you do for that? What can you do for this? And when I read about what this does, which the X39, when you put it on the point and it starts working, stimulates this thing called the copper peptide, and anybody wants to look it up, it's GHK-CU peptide. You'll see exactly what it does. And it stimulates the stem cells to work properly. And what is this going to affect? If anybody remembers from the 60s or 70s, the $6 Million Man, okay, it was like...
I have a lunchbox. I have a lunchbox of the $6 Million Man. I'm all about
Lee Majors, he was so cool.
I'm all about the $6 Million Man. Oh, yes. That's my thing. I collect 70s television lunchboxes.
Wonderful, wonderful. So you're sitting there, you know, you think, I was thinking about this. So wait, this is exactly like that. You know, we have the technology. We can rebuild him. He'll be stronger. He'll be faster. He'll be healthier. And we're all looking for the silver bullet. And I'm like, you know, I'm beginning to learn that if we could get stem cells to simply work, and that gets our body to work, and then our body takes care of when they should go, where it should go, and everything else, okay? Because that's, you know, our bodies are a lot smarter than we are, okay? It knows what to do. Sometimes you just have to give it what it needs and get out of the way, okay? You don't want to micromanage, okay? But the increasing the activities of stem cells will start curing what has been bothering our society. And usually I'm always talking about inflammation. I'm always talking about leaky gut. A lot of people are interested in anti-aging, or elite athletes who want to get that extra 3 or 4%. Okay. This is one of those things that you can do. And I'm very convinced, and I've seen evidence of it, that will improve your health, may improve certain specific conditions or certain specific symptoms, but it's all based on how the body heals itself right down from right up from the stem cell level. So this little guy, I'm impressed that it can actually do that without introducing anything into your body, and just using your body's infrared radiation, because that heat you feel coming out of you is infrared radiation, and just putting it here and reflecting. I'll tell you a little secret. I know it's got adhesives on it because it sticks to the skin. But guess what? What I found out, and I've tested with a few patients because I heard it from one of the doctors over there, and I said, it can't work. And you could take this, and let's say I'm wearing a long sleeve shirt just for argument's sake, but I'm allergic to adhesives. I can put it on my sleeve where it's just in that area, and it'll do the same thing. Okay, because it's reflecting the infrared light coming from the skin. I've seen animals get better with this. To have one for horses, although I'm not even going to pretend to understand where to put it on a horse. And I would have to get the horse's willing cooperation and agreement probably signed, because they're kind of big animals and I don't want them mad at me.
So are you saying that the patches... So are you saying, like, because I use the patches. I love them for anti-aging. I'm trying to do everything for anti-aging, and
You're doing a good job, by the way.
Well, thank you. I'm going to be 49 in a couple of months.
Cut it out!
I cannot believe.
No, you lie like a rug. You look 35. Cut it out.
No, it's true. It's true. Yeah, but I wondered, because the adhesive kind of wears off. So can you kind of just glue it back on your body and stick it back on your body again? Or
there's a question I have not gotten a good answer to, and I'm glad you asked it, because some people with some of the other transdermal patches, they'll cut it and use half of it. Well, if you cut this one in half, you're just going to dump everything out. Okay. Can you reuse it? Yes. Okay. I don't know how long these crystals in here last. Of course, if you talk to the company, you use it for 12 hours on 12 hours, toss it away. Now, why wouldn't they say that? Okay.
Yeah, of course.
But I have used them, and I've seen them used effectively until the adhesive simply doesn't stick anymore.
Yeah.
Okay. Another good thing, you can put this on, you wear it for 12 hours. You could go in the shower with it. You could go swimming with it. It doesn't peel off. Some other transdermal patches, if you get them wet, okay. I have, like I told you, I have this set of patients that, if there's somebody out there that can only eat 4 different foods, they're my patient. Okay. If there's an autistic child that, adhesiveness, I have one autistic child in Romania. And his mother, when I told him about this, as part of my treatment, I said, well, just try it. I'll send you a few. Well, she put it on first and, of course, peeled it off. And then she put one on back here where it was, and he sort of liked it. And there was a glutathione patch that went in between to the toes. And now he comes up, because he's beginning to speak now, he comes up and he asks her for it. Now, here's the thing about an autistic child. They don't lie. If something makes them feel good, they'll let you know about it. If they don't like something, you'll really know about it. Okay? You're not going to get, you're a mom. There's 2 things you can't make a kid do. You can't make them eat. You can't make them poop. Okay? So if you're trying to put something down a kid's throat who doesn't want it, especially an autistic child, good luck.
Yeah, good luck. And my daughter will not take supplements. I have to hide that in a smoothie. So I like things like this, she'll do a patch, or she'll do the My Health. We do the My Health every night that's a Nest Health bioenergetic device. It's like this thing right here. She'll do that, Wonderful. But she won't take supplements. So
there are a lot of kids that don't like that. It makes their bellies hurt. They don't like the taste of it. They don't like being forced into it. And we have to use trickery. This is if it makes a person feel good, either on a conscious level or a subconscious level, or even just a spiritual level, especially a child, because children don't have too much of a cortical override. If a kid's sick, you're going to know it. Kids usually are not faking, and as soon as they feel good, they just want to be children. Like, okay, I want to go out and play. All right, this I'm amazed with, and again, like I tell you, I usually don't hawk anything, except this is exceptional.
And what kind of conditions does the X39 Lifewave patches help with?
Okay, I'll tell you what they put in the literature. It supports wound healing, rapid pain relief, greater energy, improvement of sleep, improvement of skin appearance, dramatic anti-aging. I love dramatic. Okay, faster recovery from exercise, reduced inflammation. Generally. Now, remember, like talking inflammation or that kind of stuff, what other conditions have inflammation as a feature? Every illness you can think of. Yeah. I'm not going to tell you that this cures cancer. I'm not going to tell you that this cures anything. God forbid I should say something like that, because this is just educational information. But if you think about it, if this improves the function of stem cells, which, by the way, if you were going to get injections of stem cells, it would cost a pretty penny, okay? And it doesn't work all the time. And it's been regulated severely throughout the world, and for good reason, because that's another thing where people are getting stem cells and then they're not getting stem cells. They're injecting it places. Those are expensive and you have to travel places. This you can do on your own, has the same effect, and I've seen people get more energy, not energy, but that kind of thing where you're going through the day, you have that bump. We don't need anybody walking around like Ricochet Rabbit, or in your case, being in Mexico. Who's the Mexican?
Speedy Gonzalez.
Speedy Gonzalez, the fastest mouse in all of Mexico. Okay, And that's how says, and if he goes to Ricochet Rabbit and his deputy, he's like Ricochet Rabbit, that's his cousin, and Deputy Droop Along, we don't need to be Deputy Droop Along. We want to be Ricochet Rabbit. We don't really want to be Ricochet Rabbit. We'd like to have our energy throughout the day. Yeah. And you're doing things. How many people out there are drinking the right water, drinking clean water, eating clean, okay, maybe taking some supplements, but eating clean, exercising pretty well, and they're wondering, why am I still not feeling myself? I mean, am I expecting too much of myself? And you realize that with our environment being the way it is, that our energy, our light, and I know that sounds woo-woo, but it happens to be true, that's where the balance is. This is a non-invasive way of helping you get that balance. And I've got to tell you something. Like I said, don't usually say it. It's pretty amazing.
Yeah, I mean, I would much rather, naturally stimulate my body's ability to produce stem cells than inject them. That helps people, but 50% of people aren't helped by that. It just doesn't work. But talk to us about some of the other patches. So this is the X39. Sure. Is this the first one that you start with?
Well, yeah, the X39. If you're going to get any patch and just try it, I recommend the X39 because essentially it almost does what all the other patches do. But I said that at first, and then I ended up eating my words. Okay, they do have something called an ice wave patch, which can be used for local pain. Very, very good. They have a carnosine patch. Hold on, I got a list right here.
The carnosine patch will be good for energy, for mitochondrial energy.
Right, mitochondrial energy and cognition. They have the SP6, like I just told you, which will, don't ask me exactly how it helps with addictions, but it does in fact help with addictions. And if you use it on a regular basis, you find your cravings. Addictions can be, let's take the broader definition. Addictions are anything that you have cravings that you're having trouble, managing. So if you have a craving for chocolate, how do you know it's a craving as opposed to just a yitz? Well, if you're jumping out of a moving car to get some chocolate, that's craving, okay? But
that used to be me for sure. I used to eat a huge chocolate bar every day, but I realized it's my brain.
Amazing.
I realized it was my body trying to get magnesium, copper, and the PEA.
Exactly.
The PEA that I wasn't making.
Yeah, especially if it's dark chocolate, you're looking for phenylalanine to create the phenylethylamine because that raises your ability to focus.
Yeah, I was like, where's? I was like, I can't focus. My brain's not working. Where's the chocolate? So 3 p.m. every day, I would eat a huge chocolate bar, and it would totally work. I don't need that anymore. I balanced all that out, but yeah.
So they have a something called the Aeon patch, which is anti-inflammatory specifically, and they have this energy enhancer patch, which is kind of 2 patches. And I put them on one day, and I didn't need, people said, you shouldn't drink coffee. Well, I have 1 cup of coffee a day, and otherwise this cherub-like demeanor becomes more not cherub-like. Okay, so sometimes you got to hit the middle ground, okay? And this, I would often have to have a cup of coffee in the afternoon, because like I said, I have a practice all around, so I kind of have to stay late because the time differences in countries. So they have, and it worked. I was like, and the first time I used it, I was like, not, but, just like, hi, how you doing? I'm awake. Here's the bigger one. They have a glutathione patch. This one I'm impressed with. Glutathione, as you know, and your listeners may have heard the word, is your master antioxidant and antitoxicant. Everything you do in various pathways is to create this molecule that sucks out all your toxins. So like if you have biotoxins, glutathione is part of the therapy. Okay, if you're trying to neutralize any oxidative stress, this is what's doing it. Well, the studies that they have done, and with blood tests and so forth, show that if you use this glutathione patch and it's not giving you glutathione through the skin, increases glutathione production by 300%.
That's impressive.
Okay, And when you're dealing with somebody who has chronic infections, as I often do, okay, because that is usually the root causes of what I'm seeing as symptoms, this is incredible. We talked about the carnosine for tissue healing, longevity. You're absolutely correct.
Yeah, and it's really hard to get carnosine as a supplement. Most of them on the market are garbage. They don't, they don't get into the cell. And so there's a big problem with carnosine supplements for that reason.
Absolutely, absolutely. They have something called a silent night patch, which is stimulating the release of melatonin. And remember, melatonin is important to initiate the sleep cycle, but it is also in and of itself a great antioxidant.
Yes.
Okay.
And to detox the brain as well.
Especially the brain.
Yeah, I use the silent night patch. I really like that one as well.
My biggest problem with the silent night patch is, first of all, one of the places is here. Keep it there. Okay. Because one place is here, and the whole day I'm walking around saying, why am I so tired? I went to scratch my ear and pulled the patch off. It was still sitting there. Okay. They have something called an aloe vera patch. Aloe vera specifically for skin. Okay. Which is, it says it's the elevation of the epithalamin peptide. Okay, that's what it's doing. And they, believe it or not, came out with a Nirvana patch, which I understand from some people helps a lot, but what it's supposed to do is lift depression, increase endorphins. In other words, I don't think put you in the transcendental meditation kind of nirvana, right? Yeah. No, but remember that all of these things are stimulating acupuncture points, because they give you charts about to use. It's not hard to use. Doesn't have to be overly exact. If it says put it on the left leg, you put it on the right leg. Well, you're probably not going to get the same effect. It's certainly not going to hurt you, but it's very, very, very easy to use. And you don't have to have all these patches, maybe one or two, depending on what it is, what your goals are. And if you have dysthymia, this low-level depression that has no real reason, okay, the Nirvana patch would be golden for you, Nirvana X39, because that's exactly what it's geared towards. It's not geared to somebody who's got a bipolar depression, okay? That requires medical intervention, because we don't want somebody to, get into a bad situation. But we have, most of us are either like this most of the day, like they've had too much coffee and haven't had any, or we have this kind of low level, I don't feel so hot, I don't like my life. And unfortunately we have, TV that tells us, if you do this, you'll feel better. If you look like this, you'll feel better. If you take this, use this cream or whatever, you'll look like this supermodel. Right. Okay. This works with the very base of your body, the very base of your health, and builds you from the inside out. And frankly, that's the way it should be.
Now, are there any other patches? Because I know I've been in groups with Lifewave groups, and I've seen a lot of that's my peacock, my pet peacock.
I hear him. What he could do is like, I'm waiting for him to come by with the feathers, How you doing, Ma? Okay.
He's so
Let me show everybody this,
The neighbors love him when he starts crying at 6 o'clock in the morning. He starts crying at 6.
I bet if you don't see him, he'll be on somebody's dinner table.
I'm like, I keep wondering, why do I wake up every morning at 6 a.m.? I'm like, oh, it's the peacock.
Oh, the peacock, yes.
Yeah, so I've been in some of these Lifewave groups, and I see there's all these different protocols that you can do, that you can use a combination of patches for various things. And I've just seen, because I was curious about them, and, skeptical at first, even though I'm very open-minded. But when I was in these groups and just seeing hundreds and hundreds of people using these things and reporting their pain was going away, they're sleeping better, they're feeling better. They had like all kinds of things, skin issues going away, all kinds of stuff, getting better, people posting photos. So, I know they work. When you're seeing, hundreds and hundreds of people having success with something.
Better and all kinds of stuff. Mm-hmm. Well, I'll tell you, the patches, like I said, there's IceWave, there's the X39 IceWave Energy Enhancer, the Aeon Glutathione, and so forth. Now, here's the thing. I would recommend X39 for everybody. Number one, very easy to use. You're either putting it on the base of your neck, where the neck meets the shoulders, right in the middle, or from your navel about a couple of inches down, right along that front line. And you can alternate. That's it. It's very, very easy to use. And depending on what else is going on with you, maybe you have energy stuff, maybe you have inflammation stuff, you might want to use one or two of the other patches that seem to make sense to you. Okay. I would not use them line by line. In other words, gee, I have sleeping problems, I have inflammation, I have this. I wouldn't be buying, 5 or 6 or 7 different patches. I'd start with one or two of the major issues that you have. And I would consider, first of all, X39. Pain, definitely get the IceWave patch and something for inflammation. Other side of the coin, if you have cognitive issues or you have to, not healing well, the carnosine is great. The glutathione patch is good for practically everyone, because if there is one deficiency we all have, okay, it's glutathione. And there's loads of reasons for it, okay? And it's sort of like a mineral deficiency, okay? We live in a mineral deficient society. We live kind of in a glutathione deficient society, whether we need more of it because of the toxins or we're simply not producing enough. This is kind of a no-brainer, okay? And there are tons of protocols, and, you can go to one of the Lifewave websites. If somebody goes to my website, they can go to where, I have a shop, and just click where the Lifewave product is, and you'll go to basically a canned website that Lifewave has, but it's got tons of great information. They can contact me. I'll be happy to answer questions.
Okay, fantastic.
But I got to tell you, yes, there are a lot of people, and I've read a lot of the protocols. Some of them are really good and make sense. Some of them seem a little bit over the top. So going through some of the groups and listening to, or actually reading what people write, I say to myself, gee, it depends on what your goals are and what your major issues are. So do you really need the silent night patch for forever? You may need it for a month and maybe have it for occasional use. You're always going to need stem cell stimulation. You're always going to need to bring inflammation down, and part and parcel of that is going to be glutathione. If you just did the glutathione and X39, you'd be miles ahead of where you are. If sadness or dysthymia is one of your consistent features, consider the Nirvana. Okay, even if you don't need to use it all the time, this is not like forever, until your body gets balanced and you don't feel like that anymore, because the reason you're feeling like that is not because you dislike who you live with or you dislike your life. It's because of stuff going on inside of you, either spiritually or biochemically.
Okay, fantastic. So you guys can learn more about the Lifewave patches. Go to myersdetox.com/Lifewave, and you can learn more about it there. Yeah, and so this is, some people kind of get turned off by these things because it is an MLM. But here's the thing, I don't get turned off by that because I've tried a lot of amazing products that are MLM products. So that's just how the company chose to get the word out about their products, to get, all these housewives and other people selling their product. And, it's just one way to get the word out about your product. And some products you can only get them as MLM, because that's the only way that they're sold. So I really like the Lifewave patches. I've been using them for, a few months, and so I beg people not to be turned off by that.
Well, about the MLM, you can get the distributor price if you go to the website and you'll see these beginning packages, if you will. The least expensive one is a $25 fee that you don't have to join the MLM. All you'll get from that is the ability to buy everything at the distributor price, if that's what you're looking for. You don't have to make a business about it. Nobody's going to call you. Nobody's going to send you a million letters. I know, like, think about the Amway and stuff, that people used to just crawl up your rear end with a microscope. It's like, stay away. It's like, you can see him like, oh, let's cross the street. There he comes, But this is one of those real mild one that if you want to participate, great. If you want to make it a business, it's got a very good compensation plan. It's reasonable, okay, without you having to, devote your entire life to it. And you have really excellent products. But if you just want the products, you don't have to pay the big price. You can just do a little $25 initiation kind of fee to be a preferred customer. And guess what? You can have it all at the exact price that we pay for it.
Okay, fantastic, fantastic. Yeah, and so you guys check these out, myersdetox.com/lifewave. And Dr. Jess, anything that we haven't talked about that you want to mention?
No, just look at it critically. Okay, the thing that is going to make you confused is, can this do what it says? And I can tell you that the mechanism, although it seems a little bit strange, actually does work. That they call it photobiomodulation, or just whatever kind of light therapy, red light therapy. All these things actually work and have been scientifically proven. And it's hard to get me to believe something, especially scientifically, because I got a real critical eye. So if that's your glitch, okay, trust me, it's worth a shot. It's worth a try. Okay. Some people get immediate results, like the first time they use it. Some people, it takes a couple of weeks. And just like for anything else, if you're using something and you're not seeing any changes, well, maybe this is not something you need.
Yeah, for sure. Yeah, and it's like anything, you have to have realistic expectations. Like if you eat salads every day, eating one salad, you're not going to feel amazing from that. But if you do it every day for a month, you might see some changes. Exactly. But you have to do stuff consistently to see changes. And I people tend to give up too fast if they don't instantly see some sort of results. But when it comes to energy medicine, you do have to kind of stick to it. For a bit.
There are no magic bullets out there.
No, there's not.
And the ones that claim to be magic bullets usually have nasty side effects. So you want to give your body the opportunity to heal and then support that opportunity. So this is part of a good program if you want to head in that direction.
Okay, fantastic. Well, Dr. Jess, thanks so much for coming on the show. And where can we find you again? Tell us your website.
My website is drjessarmine.com, DRJESSARMINE, my name.com. Real easy.
Okay, fantastic. Well, so everyone, thanks so much for tuning in today to the Myers Detox podcast, where we focus on everything related to detoxification. We're going to be talking a lot more about anti-aging on the show and in the future. So tune into that. I want to tell you all my secrets about what I do, how I stay young and vibrant and feel good. And I can also honestly say all the stuff that I'm doing, all these guests that I have on the show, implementing their protocols, I feel better and better and better as I get older. I want to teach you how to do that also. So thanks for tuning in, and I'll talk to you guys next week.
The Myers Detox podcast is created and hosted by Wendy Myers. This podcast is for information purposes only. Statements and views expressed on this podcast are not medical advice. This podcast, including Wendy Myers and the producers, disclaim responsibility for any possible adverse effects from the use of information contained herein. Opinions of guests are their own, and this podcast does not endorse or accept responsibility for statements made by guests. This podcast does not make any representations or warranties about guest qualifications or credibility. Individuals on this podcast may have direct or indirect financial interest in products or services referred to herein. If you think you have a medical problem, consult a licensed physician.